for helping us be able to come before the group. We actually had this presentation planned for you. I'm thinking it was back in March, and we had something else occur in the country, and so we thought it might be worthwhile to kind of postpone this presentation just a little bit. My name's Kathleen, Dr. Kathleen Bradley. I am the Associate Chief Nursing Officer of Professional Practice and Innovation at Lucile Packard, Stanford Children's Hospital. I have been out here for around 4 years. Prior to that, I was at Children's Hospital Colorado for a couple of years. Thank you for this opportunity to present. I'll let Margie introduce herself.
Hi, I'm Margie Godin. I have been here at Stanford for a little over 20 years. I've done multiple different roles. Currently, I'm the Informatics nurse specialist. I manage our nurse informaticists, and I also manage our SIM center and oversee our intranet. I'm very happy to be here, and it's going to be really fun. I'm going to pass it. Oh, and I apologize. I don't think you can see my video. And that's because for some odd reason, when I am presenting, which I am presenting on my iPad, it will not do my video for me. So I apologize for that.
So stay tuned. This is our Think Different work that we had. We're going to go through our journey of how we were able to integrate technology into professional development and staff development. We're going to touch on topics of patient safety and looking at measuring outcomes by using technology. So next slide. So a little bit about Stanford Children's Health. We're in Palo Alto, California. We're adolescent for a children's hospital. We've only been around since 1991. We also have obstetrics as part of our hospital. So we have pediatrics and all the obstetrical work. You can see our statistics. Like you, most of our visits are in an ambulatory setting. Next slide. So a few things about us. This last year, we are very honored that we were able to get into the top 10 of U.S. News and World Report. We have achieved magnet designation, which was actually newer for us. One of the things that we have are nursing academic preparation. So for our nurses, we have 71% with BSN. 22% of our nursing staff has a graduate degree. So we're at 93% BSN or higher. So a pretty highly educated group here. I want you to pay attention to that red circle. This is one of the tools that we'll be talking about a little bit later. This is for our mentoring program. And you can see it has a little code on the bottom. And so we'll talk a little bit more about how we use that. So as many of our organizations, we are a standalone hospital, but we have many different sites throughout the Northern California area. We also expand into Reno, Nevada, and have different sites there. I've been here about 4 years, and when I came, I helped to establish the Center for Professional Excellence and Inquiry. We support not only nursing staff, but we also support all of patient care services, focusing on professionalism, excellence, and really promoting inquiry and innovation. This is a picture of some of our team. Obviously, it's at Christmas time. Thanks, Margie. So we had a project vision for this, and it was really to think about just-in-time access and education. If you think about healthcare, it's changing so fast. There's no way every nurse, every staff member is going to keep up with everything going on. And so it's figuring out, okay, how do people communicate? How do they learn? And then how do we put it right in their hands? so that they have the information they need right at the time that they need it, whether it's related to care or competency or skill set. So that's part of what we had for our vision for this work. So we started our Think Different campaign. We knew with this campaign it would require us to look at resources that we had, what kind of personnel that we needed. We wanted to make sure all of our professional development activities had this thought behind them. And so we'll ask, still to this day, you need to think different. And people then start thinking, oh, technology, how can we do education different? We knew we might need some new educational platforms to do this. And as an operational person myself, I always think about what is our return on investment? How do we demonstrate that this is the right way to do this kind of work so that we can continue on with this? So some of our considerations is we need real-time education. When I came here, most of the education was done after hours. We couldn't really think about educating at the time that we're doing work. We wanted to switch that model and flip that thinking. We wanted to make sure we had ongoing education, standardization. We know that that's how you can improve your outcomes. So we wanted to be able to standardize our practice. And we utilized the QSIN competencies. We wanted to align with those competencies too and embed them in our education. And then, we work for pediatric organizations. If you think about our workforce and our population, our parents, they're pretty tech savvy. And so how do we still meet the needs of this tech savvy workforce? And we know that for many generations, I'm old enough to say my kids, this is how they talk, but they don't actually talk. So we'll talk more about how do they use technology to communicate. So our timeline, I came to this site in August of 2016. A month after I arrived, we were actually invited to Apple and to really think about what we could do to partner with them. They said that they could help us learn about different ways of doing education. They actually have a whole department that was called a higher education team, and they offered us some help if we wanted to think about doing education differently. And for me, that was huge. It was one of the reasons that I moved here, is to be able to explore, can we use technology different? What I also realized is I needed someone who could speak technology and who could talk that language. So I needed to look at the resources within my own team. And I got together with Margie, and she said, have you ever considered an informatics nurse in your professional development? And I thought, oh, brilliant, exactly. So by May of 17, I had Margie in the department to really help spearhead all of this work. In June, we invited our partners from the higher education team to come and meet with our whole department and talk about and brainstorm how can we do education in a different manner, and what does that look like, and what tools do we need. That was a really informative session that we had. What we found was that our staff needed to have some basic education on technology. So it was brilliant from an operations standpoint in that I could send them to the Apple store to get some education. And it didn't cost me anything because this is part of what they do. They taught our staff how to use different technology and develop education in a different way. They were so gracious. They opened the store we're on the Stanford campus, and we actually have the Stanford shopping center connected to our hospital. Can you imagine? But they opened that store early so our staff could come in early and they would work with us. So that was a really big opportunity for us. By March of 2018, we had different activities and different courses already created and being rolled out.
So when I came on board in May of 2017, this was like the first responsibility Kathy gave me, and I realized right away that we didn't have the tools that we needed, right? You need the mobile devices to actually be able to create. And so back in the summer of 2017, working with our Apple Higher Education team, we came up with what devices did we need. We decided to do it on a 3-year lease. That way, well, one, if the program didn't work out, okay, after 3 years, we let it go. And two, the technology of these devices are so rapidly changing that we didn't want our devices to become obsolete. So very excited that just a few weeks ago, we actually got our second 3-year lease from Apple. So staff is very excited because now they have all these new devices. So this is what we have today at CPE&I. It's similar to what we had the past lease. We did increase our iPad Pros by about 5, and we increased our 32 gigabyte iPads to an additional 15 because we were running short. We do have some MacBook Pros, and the reason we use those is depending on the educator, sometimes they prefer to do some of that work on a MacBook Pro, so they can check it out if they need be, or they can use it in our office. We have a few Apple TVs. We use those when we need to present. So it's easy to just take that Apple TV, hook it up to whatever room you need to present on, and then you can easily screen share your iPad or even your phone for that matter. We have 65 32 gigabyte iPads, but we have the other 500 or so are in every single room in-house. So every room in our hospital has an iPad for patient and family use. And we also have probably over 1,000 iPhones, and the reason we have those is for our staff to communicate. So we'll go into a little more detail, but they use the iPhones as a way of communicating with each other. So this was really the first things that we tackled when we started this program. So we started our first ebook, which we got right early on. One of our, I call her our rogue MPDS, Dion Margallo, created that. Oh, I apologize. I take that back. Dion did not create that. That was actually created by Chelsea Noon, one of our clinical nurse specialists. Very early on, we created an ebook. We also used QR codes. We'll get into more detail of that. But QR code is a way for staff to access the material very quickly using the iPhone that they have during shift. We do 3-minute sims, which is really sims at the bedside that we want to check off a nurse for competency or skills, and we'll do that. We created videos very early on, and we created courses very early on. All the phones that the staff use has the Bolt app. That's that app with the big V that's pink. That's the app that they use during shift to communicate with each other. And we also very early on started a very innovative BLS program called RQI, which allows staff to, on a quarterly basis, do their skills for life support, and it's a way for us to keep current with all of our skills. So this is our first standardization of care ebook with central lines. So we really wanted to look at our CLABSI rate and bring that down. And so one of the first things we did is created an ebook. We changed some of the way we changed out the lines, some of the ways that we drew blood from the line. And so we needed to get this education out and pretty quick to our 1,500 or so staff. So the ebook was a great solution to do that. We were able to embed videos. We were able to give nurses a real-time access to it. They could do it when they had time during shift. It wasn't something that we asked them to do before or after shift. They actually did it during the shift. And then when they were done reviewing the ebook, then we did a 3-minute sim to sort of validate that they understood the new process and that they could actually do the new process. And so since then, we actually created a new timeline of where we wanted to go with this program. We've done a lot of videos. We actually have more ebooks. We use our shared governance to help us create content and create videos. We've done some presentations, either, well, pre-COVID here, or we've gone to Houston and other platforms to give presentations. We now have a publication that we wrote that was published in February of this year. We've done briefings at Apple. What we still are working on is incorporating virtual reality and augmented reality into our programs, and we think some of that will begin early 2021. And then one of the things that happened this year is when COVID came into being and we needed to quickly get information out to our staff, we quickly realized what this program has given us. We'll talk more about it, but it really helped us really get some of the information we needed to get out quickly. And so this is some of the work that we've done since then, since we started over the past couple years. We actually created 2 books. A little over a year ago now, we had our magnet site visit. We really utilized this technology in bringing in ebooks. We had one for staff that they could look at and use and reference during the visit. We also had one for executives that they used when they had their site visit. So it was very successful. We have lots of videos that we do. I referred to it earlier. So if you look at the picture of sort of our course library, the first book on the top left is our very first learning management course with neonatal. And like I said, Dion Margala, one of our MPDSs, created that course. Since then, we actually realized because people want to create them, so the 2 below that are our most recent courses, and we actually have standardized the templates since then. So all of our courses will have that same look and feel. And the little business card on top, that's how we get a lot of our education and information out. It's a QR code, but a lot of times we'll do it in a business card, and we sort of hand out the business card to people to say, hey, look at this video or look at this tip sheet. And usually you'll see them sitting out, and people just scan them when they need them. It works really well. Oh, I don't want that. There we go. And so then why did we choose to use a content learning management system versus paper? And I think what this gives you versus that static paper is that you're able to embed videos, you're able to embed links to articles, links to policies. So what happens when you have paper, right? You can put a lot of this stuff in there, but as soon as that policy changes or the article gets obsolete, you still have it in there and you have to take it out, redo it. With this, as a person who has access to that course, anytime that course is changed, it'll change it on my course too. So my course that I have will always stay new and fresh. It allows for collaboration. So we actually created a course this year for our nurse residents for their evidence-based practice project. It allows them to quickly and easily collaborate with each other online. They don't have to be in the same room. They don't have to be on the phone. They can just talk to each other as they're working on their project. Another thing that is nice is if you embed quizzes or assignments in here, they can submit to the instructor electronically, and it'll send an automatic alert to the instructor if you want that tells you that somebody has submitted an assignment. It also allows the instructor to collaborate with the students and easily contact the students. Some of the courses I kind of alluded to is our neonatal new hire course. That's our first one. Our evidence-based practice courses are the two below it with that sort of standard look and feel. But what we did recently is another one of our MPDSs, Miranda Schmidt, created a nursing assistant skills course. I was a little leery about it at first, just trying to understand, do our nursing assistants have the technology understanding to be able to do it? But we went ahead and tried it, and it went swimmingly. I mean, it was very, very successful. We got very positive feedback, and they all really enjoyed having it online and interactive. They were engaged. It was great. So it just goes to show me that we can do this with anyone. It doesn't matter. They'll learn how to do it, and they love it because they're used to it.
Okay, measuring effectiveness. This is always an important consideration for anyone in professional development to really make sure that you discuss the value of education and the value of your methodology of doing your work. So in our first year, really evaluating the effectiveness of using technology, we knew that even with RQI, the way that we do our certification for BLS, ACLS, and some of those courses, that we would see a cost savings. Instead of having everybody come for a 2-hour education time period for demonstration, they just did it during work hours. So we saw pretty good cost savings with that. We did an RPI, which is a rapid process improvement event related to the CLAPSI. And at that time, the team came back to our CPEI leadership, our center's leadership, and said, here's our proposal, 4 hours of education for all our nurses on our new standardized processes. And that's when we pushed that little piece of paper across the table to them and said, I want you to think different and come back with a technology solution. Margie already showed you that first book that we did, and that was around that education. What she didn't tell you was the price tag for that 4 hours of education for our nurses was over $500,000. And so $500,000, and I thought, wow, that's a pretty big hit. I know it's really important. We need to figure out how to do it. So they came back with the new plan of using the ebook and then the just-in-time competency demonstration. It ended up costing us $34,000 because we did pull some nurses out of the count to be able to go around and do the validation. And so from over $500,000 down to $34,000 is a pretty significant savings. So for that first year, technology education saved us over $800,000. Next slide. So the next year, we were looking at, okay, what is our return on investment? We had smaller units that we were doing, smaller education initiatives for, and it really was about half of the cost that it would have cost us to have actual in-person education. We did a big push on our hospital-acquired pressure injuries as our next hack that we really addressed, and we had some pretty significant cost savings in that education. So between the first two, and it was really the first 18 months, we had total savings upwards of $1.4 million for our educational efforts. But we know it's not really just the cost of education. We really wanted to measure clinical outcomes with this education, and was the education effective in getting our staff to really have better competencies and better demonstration of care for our patients. We saw a 48% decrease in our CLABSI rate and a 78% decrease in our HAPI stage 3 and 4. And part of that was the standardization, and part of it was staff really took it to heart, and this method of education was really effective in getting that message out. So also looking at what are the tools that we're using for this, and by far the biggest request that we have is about QR codes, and we're going to talk a little bit more about QR codes in a minute. But I think this is something to really consider as one of your key tools that you'll be thinking about when you start into this journey. And getting a methodology and a way to be able to change your QR codes is really important, so stay tuned about that. We also have a lot of requests for videos, and you'll see we have more videos than we have ebooks. And then Margie had talked to you about our content management courses. I think one of the smartest things Margie actually did was she created a technology council and committee to really look at, okay, if people want something, is that really the right kind of technology? You know, we need to consider our resources in helping to develop these. And so as we manage those resources, are we using the right type of technology for the education and competency that we need? I'm going to hand this back to Margie. She's going to talk about some of the tools of the trade as you think of technology.
Yeah, so, you know, what do we use and how do we use it? So I kind of want to get a little more into the detail here. So I think we're all children's hospital, so we think about our workforce, we think about our families, and at least our families tend to be on the younger side, very used to technology. Some of our older patients, that's what they're used to. Our new residents, our new physicians, our new nurses, they're very well versed with technology. They grew up with it. And we have to think that way when we think about how we're going to educate. And so I like this slide because this is a typical week here at Stanford Children's. In a week, we have about 1,100 users of our iPhones with the Bolt app. So there are about 1,100 users who use that Bolt app. And if you look at the ratio between phone calls, using the iPhone, because they can call on that phone, versus how many times they text, it's 3 times more. So what it tells me is that they don't call each other, as Kathy alluded to, they text each other, right, because it's faster. They can text, they can continue on with their work while they wait for their response. So that's how they want to be educated, right? They want it when they want it, at the point of care, at the right time. So we have that, when you think about that, that's how we think about how we educate our staff. Kathy.
Some innovations in action, and thank you, Margie, for talking about this. So I am not from California. That's not my home. I came out here to hopefully use a little bit of technology. So it was new to me. When we were getting ready for our magnet journey, I was in charge of the process, and I knew I needed to get some information out to the executives. And my thought is, if I could get something to a physician who's walking down the hallway, because that's when he's going to look at what are those magnet appraisers going to ask me, how do I make that happen? And so they were working on my computer one day, so I took my iPad and I created an ebook. And I went out in the parking lot. My office was across the street from the hospital, and I snapped that picture of the hospital. And then I thought, you know, it's going to be so impactful if I have a video from our CNO in this book. And so I was sitting next to her in shared governance the next day, and I said, Kelly, I want to do a video with you to put in the book. And she said, oh, great, I'll contact marketing. And I said, oh, no, we're going to do that video right after the meeting. Just join me in the hallway. And she looked at me kind of surprised, and I said, oh, yeah, it's going to be great. And so I had my iPad, and I had the script taped to the bottom of the iPad ready for her to go. And we shot the video. Margie helped me edit it, and within an hour we had a video ready for our book. And so this is the book that was ready to go. I had the opportunity to be in a meeting a couple days later after we finished the book, and I was with the CEO, and he was brand new to the organization. I said, would you like to have our book in preparation for our site visit? He said, sure. And I said, great, I'm going to just airdrop this book to you. And he just looked at me. It was such a great opportunity to really teach our executives about the work that we were doing and how impactful this work would be for our staff. And I think it helped us move some of that idea about the use of technology in our settings. I also want to talk to you about the isotope room. So you're familiar with a therapy that you can give to patients for when they have certain kinds of cancer, and they can get a nuclear isotope implanted. These rooms are very specialized, and maybe they are used a lot at your organization, maybe not. Maybe a nurse only gets into this kind of room and this therapy maybe once a year or even less. And there's so many things to remember to do. So it was a brilliant idea that Margie had. Why don't we QR code the room? And so that nurses would have that information just at the time that they needed it. So there's a QR code that's by the computer that tells them this is the special charting and documentation you need. A QR code by the trash can. This is how you take care of this. And it goes straight to a video. That's a short little 1-minute video that shows them how to do it. But it's having the information in the palm of their hands that is so impactful. And so that's why I say the power of the QR code has really spread. We found that we used QR codes when we opened our new hospital. That was our first use of them. We were really wanting to get that in our nurses and our staff's hands so that they could see, oh, this is a new lift equipment. How do I use it? Well, I have this tool. I can just scan that code, and here's the video to show me how to use it. And so you connect those, and you make it a workable solution. The maternity unit wanted a QR code for their wormers. How do we turn this thing on? How do we adjust the setting? So they requested that. So now that's on that equipment. I would say our leader of Revive, Linda Knight, also was very creative in thinking, you know, we have sepsis incidents that happen, and we have to follow that protocol. How do we remind people what to do at that moment? She placed a QR code on the crash cart with the sepsis algorithm, so that's now accessible for people. So having that just-in-time information right there at the fingertips is so key.
The one more thing on QR codes, they're actually really good. A lot of people have been utilizing them, but be very careful if you want to go down this route to make sure that you get a QR code that is dynamic. And what that means is that you can change the URL or where you want it to go on the back end, and you don't have to change the front end of the QR code, right? You don't have to change the QR code itself. It's easy if you only have 1 or 2 QR codes, but like us, when you get into the hundreds of QR codes, it would be, and you know, people are giving them out like crazy because we have these business cards. It'd be really hard to, you know, get the old ones back and the new ones out. So make sure that you have a dynamic QR code. That's really important. There we go. All right, so game changers. So these are things that we have noticed that have really, in a lot of ways, changed the culture of how we do things here. The first one that I like to talk about is research and how we've utilized REDCap or any kind of research database. So about a year ago, I was conducting some research, and as I was prepping and getting ready for it, it was typically done on paper, right? We all know, and I had nurse observers that I was using, and they go around with the clipboard and they do their observations, and then they'd write it down, and then they'd give me the paper, and then I would work with someone who I pay to actually get that paper into REDCap. And I just thought, this is kind of ridiculous. I think we can do it a better way. We're lucky that we are affiliated with a university and a med school, and so with our Nasser, our nurse researcher, I started doing some, my own little research and trying to figure things out, and I was able to work with a team here that created a form for me that would go directly into REDCap. And that way, when data was collected, it went directly into the database, and there was no risk of, my data integrity being lost because of manually entering. I actually then added, there's an app, I added the REDCap app to our iPads. I gave the iPads out to the nurse observers, and we got over 300 pieces of data in about 6 days, and it worked great. I was able then to access the data right away, right? I didn't have to wait for somebody to input the data, and I didn't have to pay somebody to input the data, so I ended up having more of my grant money. The second thing is ebooks. Courses are great, and they can be used, you have to really think about where you're going to use them. Books, on the other hand, if you work with your IT department, we're going to get the Books app actually placed on all of the phones very soon, probably by the first of the year. Then we can load all of our books on there, and then we actually can have nurses really in real time. It will really decrease our QR codes because they can actually go into the book, go by chapter, and actually look at exactly what they want. We can link them out to the policy. They can look at a video quickly. So those are really changing how we do things here. Kathy, you want to talk about
our nurse resident projects? Last week I had the opportunity to go to our graduation ceremony for our nurse residents, and they present their evidence-based practice projects. And I was so tickled. I knew that we had made a difference, and we were entering a new phase when over half of the projects that the nurse residents were doing were creation of videos to help them in their work. And so it validated that, yes, indeed, this is the methodology that they're using to really help them do their work correctly, to create more standardization and make sure that we are following our policies. And kudos to the CVICU and NPDS Froy Ascano, who helped lead this project. The video you see there is the CVICU nurse residents who found that there was a lot of practice variation in how people prep transducers for care. And they went to the policy, looked at the policy, looked at the literature, and found that if they did a video, their thought was if they did a video and showed nurses along with the policy, that people would be more comfortable with this practice. And so they did their assessment, created their video, and did a post-assessment. And they said, we couldn't figure it out. We had more people who did the post-assessment. And I said, it's because people wanted to watch the video. They wanted to see how to do this process. And so how exciting for us not to have to chase people to do a post-assessment, but having more people want to do this work. And the brilliant game changer is this video is now embedded into the policy. So not only do people have the words, they also have a picture and action of how to do this work to really help them understand it. And they can have better access as they need to continue to review it if they don't do it that often. Okay, now something happened this year, and I was so very grateful that we had gone on this journey before COVID hit, because what we had learned and what we did when COVID came about really put us in a different frame to get information, education, and training out there for our staff. The immediate concerns with COVID was that we needed education. A lot of it was around supplies. There was 1 week where we were really afraid. We were running out of N95s. We didn't have we wouldn't have enough of our regular capper stuff, and we had to go into this new capper material where nurses and staff would actually have to build the hoods together to make it happen. And this was nothing that we had had before. So we needed immediate education. So, of course, our team was called upon to do this. And you can see the pictures. In the background, I've got someone from occupational health who is standing by and making sure we're doing this right. We've got two of our educators. We've got Dion, who's got her computer because she's reading the script, and Miranda, who's filming. And you can see we just use iPads and we use our phones for filming our videos. And we have a member of the flow pool who gladly volunteered to create this video. In fact, I came in over the weekend and was showing the video just in case we were running out, so that people would actually have seen a video and seen, we didn't have equipment to share for them to practice on, but they could see the video of what this looked like and got some feedback. The other really key thing was people needed access to information, and so we had done a lot of work with the website, and we were established so that we were the ones who helped create the website for the organization, maintain the website, and have everything ready and at hand. People needed resources. So they needed to know, how do I do this? Where do I get supplies? What is the supply? This is a new supply we've never seen before that's showing up. The thought of putting tip sheets out and collecting them and having the information updated was just impossible. It had to be done through technology so that we could fix it on the back end. And we used QR codes by equipment so people could scan and get the latest information that they needed about what is available, how do we use this equipment, and then nimbleness. Our supplies, I'm sure like yours, were changing daily, if not within that same day. And so having that ability to be nimble and create new information, having it available was so important. And so being where we were ready with technology was really huge for us and a huge benefit to being able to make these changes happen. We also found some really other big successes. Because we were using RQI, we never had to stop or delay people doing their BLS certification or their PAL certification or any of those, because we were already using the technology and we could have appropriate cleaning with that. I know of other hospitals that are still going through a backlog of staff trying to get them caught up to date from this spring. So, wow, technology made a huge difference there. And then, like many of you, I'm sure, we had to quickly onboard clinical nurses to be ready to care for our patients. And so when we used technology and did onboarding in a different way, we were able to get around 60 or more nurses onboarded within a day or two. And so that was very impactful.
So what are some of our lessons learned? I think it's very, very important that whenever you're doing some sort of educational change, innovation, to really reach out to those frontline users. Get their opinion on it right away. We have a robust shared governance structure here, so we use our shared governance. And I mean, now it's very, very different, but in the beginning, just trying to get them to understand where we wanted to go really helped with sort of the buy-in of the staff. Have work groups and work very closely with if you want to go down this route. We have a Apple higher education team. Everyone has one. You just have to figure out who it is. You can email us, and I can email my contact if you're really interested. They are all over the country, but you really have to partner with them. You also have to work with them and your IT department. Very important to get them. Once we started getting these devices, one of the first things we did is partner with IT or our IS and really help them understand where we wanted to go and what we needed from them. We're very lucky that we're close here to Apple. And so the picture down below is all of us back in February. It seems like such a long time ago. We actually got to go, and they did educational day for our staff. So it was really good. But everyone has this opportunity. You just need to know who to ask.
And I would say we're not saying you have to have one type of technology or another. We have methods to convert it to EPUBs for people who have Android devices. A lot of the things we use are also apps, and we also use things on Google, so we're not promoting any one thing.
No.
We just needed some way to start using different technology.
Mm-hmm. And so then what's next for us? I talked a little bit. We're going to expand the iPhones that the nurses have. Nurses, physicians, RTs, almost every staff member who is on has a phone that they communicate on, but really starting to work with IT, adding more apps so that we can actually really make it as powerful as it can be. We are an Epic site. So Epic does have apps that nurses and physicians can use to document. So we really want to get that on the phone because that'll really help our nurses really start looking at our ROI. We do, but probably not as good as we could be. We could be better at that. So we really want to make that just a standard part of what we do. Expansion of videos as an educational tool. Kathy, we do use our iPads a lot, and we use phones, but we probably need to get some dedicated phones just for video creation because it would make life easier for our simulation staff who get asked to do videos a lot and help people with videos. And we're always looking at different ways and different apps and things that we can use for our course development. So the Clinical Digitization Committee, that's one of the things we do, is really trying to stay on top of the technology and what we want to use. So really, that's an ongoing investigation for us. And then we're exploring the expansion of patient and families. As I said in the beginning, all of our rooms have iPads. How can we utilize that to really help educate our patient and our families? And incorporating augmented reality and virtual reality into our education, especially with distance learning now. This can this will become a game changer once we get to this because it can really change how you educate staff across the entire enterprise.
I think we got a little behind our schedule in that we had to stop doing some of our innovations because of COVID. And so hopefully we'll get back online to really expand some of the innovations that some of our team is just itching to start doing.
So these are just links to a couple articles that Kathy and I wrote. The first one is really about our journey and how we got to, where we're at. The second one is just a quick article on just-in-time learning and how we use QR codes. So if you're interested, those are good reads in my mind. And then I'll just open it up to questions.
Very good. Kathleen and Margie, thank you so much for a wonderful presentation. We do have some questions from the audience. Great. And one of them is, when staff are using the QR code on their iPhone, are you speaking of work phones and not personal? Or can you clarify?
We ask them to do it on their work phone, yes. So on the phone that they pick up when they're on shift. I will tell you though, the mentality of the nurses, especially the younger nurses, they will use their personal phone if they need be. But our ask is when they're working and they can use their hospital issued phone.
Thank you. Another question in the chat is, I'm curious to know if you've had to overcome barriers related to use of iPhones while on clinical units. There's been some reluctance in our organization to use those due to concern about how this may be perceived by families.
So iPhones are a tool for communication, and so there is education out there. That's where you need to have that think different mentality of how do we use those. And I think part of that is how do staff also talk to their patients and family about what they're doing on their iPhone. I'm talking, well, remember, a lot of it is text. Mm-hmm. But I'm looking at some education that I have available. And, we have screensavers that talk about education and have QR codes on them. I mean, so families see that that's a part of how we communicate too.
And work with your IT department. So you can lock down any mobile device. So, when they first got the iPhones, when they decided to use iPhones, they actually locked them down really tight. I didn't realize that. That was a barrier when I went to use one, and I'm like, what the heck? I can't get Safari, right? I couldn't get on the internet. So that was where it's sort of that partnership. So we've opened them up a little bit. Now we're going to allow to get the Books app on there for our staff. So there are ways that you can control a little bit how they use the hospital issued phone.
Very good. There are a couple more questions, but I wanted to let our audience know as well. If you'd rather just come off mute and ask your question, just click that raise hand button. And another question in the chat is, how do you track compliance?
Oh, I forgot to talk about that. Okay, so it depends, right, what level of education it is, 1, 2, 3, or 4. With level 1, it's, nice to know. It's out there, they can read it. If it's a level 2 or above, it sort of depends. But if it's a level 2, you can actually add a link to your LMS, to your learning management system. So, for example, our LMS hospital-wide is HealthStream. So I can create an attestation in HealthStream, link it either on the tip sheet or at the end of the video or on the email we send them. They click on it, and then they do the attestation, and it says, I have read and understand, and that's how we track compliance. If it's a level 3 or 4 that needs return demonstration, then we do our 3-minute sit, right, where the NPDS or the CNS or the unit leadership might go around and start checking people off. Really depends. We're very careful how many level 3s and 4s we do in a year because it is quite time consuming for our leadership to get those completed.
Very good. And you've sort of already answered this, but I'm just going to go ahead and ask it, and maybe opening a can of worms. What LMS and content management system platforms do you use, and are you happy with them?
Yeah. Go ahead, Kathy.
We're part of a bigger system, so we use what the system has in place. And what we have in place is HealthStream.
So we use HealthStream as our LMS for our like online courses. Currently, we're using iTunes University, which is an app through Apple. They will be sunsetting that app at the end of 2021. So we are looking at other platforms, and some you have to pay for. So we're being very careful, but we're investigating a few different platforms right now because we know we have to move off of iTunes U.
Very good. And we have another one. So the entire chat says, this is great. Has there been any concerns with nurses not receiving important alerts or alarms while viewing or interacting with important educational items? And also, thank you for such creative and innovative thinking.
You know, what we wanted to do is see the effectiveness of the education, because we had to do a lot of, we did some things via tip sheets. We did not a lot of classrooms. Very rarely do we have any more classroom education. And so we do rounding where we ask people about the information that we've pushed out, and our educators and our leaders partner together to do those roundings. And they just did a series of roundings to see how well did people get the information, how well were they able to retain it, was it an effective modality? And so at this point in time, yes, they like it. They've said that they like the QR codes, they like the access, they like the videos. And we know that also from the work of the new grad residents. So that's what's being bubbled up as what is an effective way for them to learn and then to be able to display that practice. We also look at what are the outcomes, so our CNSs monitor that practice to see if we are indeed following our process, if we're able to get that standardized change to actually be sustainable.
And the other thing about the alert, I'm also on another committee where we actually look at the use of our mobile devices, and that's in the IT department. There's a way to do hierarchy so that if an alert were to come through, it supersedes something else on the iPhone. I'm not that technical, but there are ways to do that, and they have it set it up in some way.
I think we forgot to mention the length of the videos. Our videos are not long. We don't have videos that typically are over 1 to 2 minutes because people, like Margie will say, people will turn them off. And so your videos need to be short and sweet. So you need to figure out what are those key points to get out. There's some tricks that you can use to speed up your video, or what elements do you put on there. So really consider the length of the video. It's very key.
Yeah, anything over 3 minutes, nobody will watch. So you're wasting your time. So yeah, we don't have long videos. Thank you, Kathy. You're right about that.
Very good. We have about 1 more minute. Julie Hahn has a question from the chat that she's going to share.
Yes, it was, can you explain a little bit more about the ebooks?
Oh, ebooks. I love ebooks. I've made a couple myself, and I'm the old leader in the group here. We've got new ebooks on NRP. She's got an ebook on NRP. We have the ebook on the central line standardization change.
Yes, so you can, ebooks are pretty easy to create, and the nice thing about them is you can embed, so like in that very first ebook we did, we had embedded a video, we embedded links, we embedded the competencies, and then you can do it by chapter, and so that way they can, you know, open that first page and go to whatever chapter they want. It's a really great way to get information out there.
Very good. Kathy and Margie, I want to thank you both so much for taking the time to share this today. We are up on time. However, any of the questions in the chat that were not answered, we will send those to the presenters and for your answers. So we will get those answered. Also, the link to the recording will be sent out to all those who registered. So you get to hear this again or share it with other staff as well. And Kathy and Margie have also asked us to include their contact info so you can send questions directly to them. So that's very gracious, and we appreciate your time and your willingness to share. Thank you everyone for joining, and thank you again to our fabulous presenters.
Thank you everyone. Bye. Bye-bye.